Welcome to the She Lives podcast, a show for women who are seeking encouragement and inspiration in everyday living. While our lives have changed, our desire to stay connected to each other remains the same. Learn from empowering women on living a happier life. Yes, it's possible, even during a global pandemic. Take a break from the chaos. Let's work together to find joy in a world that feels like it's on pause. My name is Michelle Hancock, and I'm your host. Remember, if you love this podcast, please take a moment to rate, review, and share with others. Community is so important. Thank you, and enjoy the show. Thank you for joining us. Today's show is an important show. Every show is important, really, but I'm very excited to hear from my dear friend, Mandy Thomas. I've been following her journey on Facebook. She has decided to go to New York, and she's going to tell a little bit more about her experience, how she's fighting COVID-19 on the front lines. And we're also going to talk about, some things that we can do to support our healthcare. I just really wanted to pick your brain. I don't really have a whole lot prepared. It was just on a whim. I messaged you on Facebook. I said, hey, can I pick your brain? I'd really love to hear what's going on over there. So, hi, Mandy. Thank you for taking time. I know you're probably mentally and physically exhausted right now, but can you tell us a little bit about yourself and what you're doing right now?
Hi, Michelle. Yes, you got it right with the mental and physical exhaustion. I have been here a week now. And they put me on night shifts, so I'm actually fixing to go in for my shift. But this is so eye-opening because I came from Texas where, they don't have near as many cases. Now, Dallas, there are tons of cases in Dallas, but they are not to this extreme. The streets are empty unless you have military clothes or scrubs on, or you're homeless.
You were walking around yesterday. I saw your pictures. That looked like a scene from a movie or something.
It was. I've been to New York one other time about 15 years ago, and it was constant. They call this the city that never sleeps, and I saw that to be true 15 years ago. Now it's the city that sleeps all day. I was able to go sightseeing from the car, and there's no one on the streets. Times Square is empty, except for there might be 50 people total on all the streets down there. And we saw a few sightseers here and there. Most of them are nurses and CRNAs or doctors or respiratory therapists that came up here to help that have not been to the city before, since there's no vacationers anymore up here.
So tell everybody what you're doing and what you did in Texas. Like, talk about your medical experience. And I also want to find out what drove you to make the decision to leave your family and go to New York.
So I've been a nurse since 2002, and then I transitioned from normal nursing, usually ICU, to I'm now a CRNA, or some people call it nurse anesthetist, some people call it nurse anesthesiologist. So I do anesthesia day to day, whether it's in the OR for various surgeries, or I also do epidurals and C-sections for labor and delivery. But here, since there are no elective cases being done in Texas right now, I was sitting at home except for my call shifts for labor and delivery. So I decided that if I wasn't going to be, helping people on a day-to-day basis there, I asked them if I could take a leave of absence to come up here where I knew that they needed help. And being a CRNA, we're very versatile. So there are some CRNAs up here that are working as ICU nurses. They have me in a role where I am doing respiratory therapy for patients. I'm checking the ventilators and the CPAPs and the BiPAPs and whatever breathing apparatus these patients are on. So they've really made us very versatile. So there's quite a few CRNAs that have done the same thing that I did, answered the call for help that New York had, and we've left our families and we've come up here. I'm doing a 3-week stint here, and then I will go back to Texas to quarantine for 2 weeks. There are some people that are doing 4 weeks. There are some people doing 6 weeks. Some are doing 8 weeks. I actually have several friends up here. I have an ICU nurse or an ER nurse that is here in the city helping. I have an OR nurse that is working as a floor nurse here. And then a CRNA friend of mine is also here with me.
So tell me about when you first arrived to your first day of work. How was that? Were you nervous? What did you expect? Was it different? And then also, has New York been very welcoming to the help? What is their attitude and morale?
New York has been so welcoming. People thank you on the streets. If you're in scrubs, they thank you every day on the streets. There's one CRNA that is up here with the Army, and people are trying to buy her food every day and thanking them. There's a high military presence now coming into the hospitals helping as well. As soon as I set foot in the hospital, it's scary. Even for me, with as many years experience as I have, and I've been through SARS and swine flu and H1N1 and all those, none of those actually even fazed me. This one, it scares me because it spreads so rapidly. You don't even know you have it until you start seeing symptoms. And by the time you start seeing symptoms, you've already spread it to others. So I do not go anywhere without a mask on. I don't leave my hotel room or the respiratory therapy room that we do our charting. I don't leave those two places without a mask on. So, and that's how most people are. There are some brave souls that walk around with no mask on, but I have no idea why they're doing that.
There's a lot of denial out there. And what would you say to the people that think this is all fake and maybe we're overreacting and we need to just open up the economy?
I was one of those before I came up here. I really thought that everyone was overreacting, that it was just another flu. It didn't faze me. And then as soon as I got here and walked into the hospital and saw that every single person in the hospital has this, and there are young people and old people dying, and they're fine 1 minute and then they die a few minutes later, and there's nothing that you can do to help them. I have completely come around to we are not overreacting to this. This is far worse than what the media is even portraying because the hospitals are keeping it under wraps how bad it is inside their walls, and that's what they should do for patient confidentiality. But it is far worse than what I expected. It is not political at all. There's no way to blame anyone for this happening. The only way you can help prevent the spread of it is stay home. Stay home unless you have to. If you have to get out, wear a mask. Don't throw that mask on the ground. Don't throw your gloves on the ground. Use your hand sanitizer. Wash your hands. Hand sanitizer is not going to be effective if you use it 50,000 times and you never wash. If you have comorbidities like asthma, COPD, emphysema, heart failure, anything that that could threaten your health, don't go out. It doesn't matter. Walmart is Walmart, Kroger, grocery stores are a breeding ground for viruses. It has always been like that. That has not changed. So if you're going to go to the grocery store, it should be one person, and you should take your hand sanitizer. You should stay 6 foot away from people. Wear your mask and wash your hands. That's what you should do. And I understand that having all the economy shut down drastically has really cramped our style, but it's for the good of everyone. This is not going to stop if we reopen everything today and the streets are full again. It's going to start peaking again. Our decline that we're seeing in the number of new cases, that decline has nothing to do with the people that already have it. It's a decline in new cases. So the people who were sick before that decline are still sick. They are still dying. That decline does not mean you cannot get it. That means that it is still there, but the social distancing and the shutdown of the economy is working. People have learned how to wash their hands. and the face masks are necessary. But there are a few things that, could safely be done. It needs to be a slow reopen of the economy, not let's open everything up. I'm really sad to see that gyms are going to start opening back up. Very sad to see that.
I used to work at a gym, and that's a breeding ground for germs. I know that just from being sick all the time.
It is. I was very sad to see that Texas was going to make that decision to reopen things like gyms. Those are not needed. Go outside and run. If you need exercise, go outside and exercise, but stay 6 foot away from someone and wear your mask.
What are you doing right now to take care of your body? Like, what are your shifts? How many hours are you working? And how do you even fathom to like calm down and take care of yourself right now? I'm trying to figure that out for you.
So, so I left a lot of my feelings at home. I mentally prepared for this. I knew it was going to be a disaster area. It is, it's not as bad as I mentally prepared, but it was still worse than what I actually expected, if that makes sense. I'm taking my vitamins, my vitamin C, my vitamin D, zinc. I'm staying hydrated. I'm watching my nutrition because I'm working 12-hour night shifts. And if anyone's ever done night shifts and then come off of them for years and then gone back, that takes a toll itself on the body. So I feel like nutrition, my vitamin supplementation, and hydration are my biggest defense against this. Plus, I make sure that I get enough sleep every day because I'm doing 12-hour shifts in a row, and then I have one day off, which was yesterday, and then I'm doing 6 more and one day off. So I'll do that for 3 weeks, and then I will come home and quarantine at my house with no one there. Quarantine is different from social distancing. People keep on getting these terms mixed up. So quarantine means your doors are shut. You do not leave your house, period. If you need groceries, someone brings them, they put them on their porch, and they walk away. That is what quarantine actually is. Some people are isolating electively. That means you stay at home, you go out when you have to. Okay. And then social distancing is just you're staying 6 foot away from other people. You are not intentionally going around people in close proximities. So I've seen, especially on social media, people are interchanging these terms. If you have symptoms, if you have a fever, if you have a cough, if you have any of the symptoms, you need to quarantine. That means no one is with you unless they also have symptoms. And so I will be quarantining for 14 days with no one else in my home. No one allowed to be there. People will bring me what I need and they will put it on the porch and they will walk away.
How are you able to stay connected with your family right now? Are you FaceTiming your daughter and your mom and dad?
I do. So I have a 7-year-old daughter that is with my parents, and I electively sent her to my parents when all this broke out because that is the safest place for her. They live on 550 acres in the middle of Central Texas. So they socially isolate every day on
Yeah,
purpose.
this is just another day for them.
They've waited their whole life for this opportunity.
There are a few people like that, and I'm like, God bless you. You're now laughing at us all.
Yes. So she has been down there. We FaceTime at least once every day. I've already finished FaceTiming her today. And then she likes to see the streets of New York. So I have been FaceTiming her on the drive to work. When the person that came with me will drive us to work where I can FaceTime her and she can see the city. And at the same time, I FaceTime my mom and my dad, and they get to see a little bit of the city too. My now 22-year-old son, today is my son's birthday, is in the Army and they are locked on base at this point. So I call him and FaceTime him as well when I can. So he's a little busier, so it's harder to catch him, but he'll call me late at night, and I can chit chat with him. So
What do you hope that this experience will teach your family?
yeah, I hope it shows them that, as a society, if we are able to help someone, we should. I had a unique set of skills being a nurse for so long, and then transitioning to anesthesia. I have a set of skills that is useful here. And so I talked to my family before I came, and they understood that my son refers to this as a mommy deployment. So he is with the military, and he does not get to choose when he deploys or where he deploys, but he knew that I could help, and he sees this as a voluntary deployment. My daughter thinks she refers to my job as mommy's a saver. So she knows that I'm coming here and being away from her, and she cries sometimes, and she has moods that are up and down, and she wants me back home. But she understands that mommy is saving lives being here. I'm offering a reprieve for the staff who has been fighting this since January without any sleep or support or before it even got really, really bad up here. One of the reasons it got really bad is because no one knew what we needed to be doing. They didn't know that N95 masks were what everyone needed to be wearing, and face shields, and things like that to help prevent this. So there are so many healthcare providers that have gotten sick, and some have died, and they have to carry their sorrow with them after losing a coworker because they don't have any downtime to grieve. So after this is over, PTSD is going to be real, and it's going to be real bad up here for healthcare providers, because they haven't had the downtime yet for it to sink in. And just the little bit that I've seen, I've seen faces right before they die, and I will never get that image out of my face or out of my mind, because I'm one of the last views they had, and that will haunt me for a while. It's just, we came more for this. We want to save lives, we do, but we came to help our healthcare providers here. We answered the call to give them a reprieve, to let them have some downtime.
That's amazing. And I mean, I know these patients are just terrified, and they can't have their family visit, right? It's just them.
There are no visitation unless you're in labor,
Okay.
or you're a pediatric patient. Otherwise, there's no visitation. There's some hospitals that are doing one healthy person, but that person has to remain in the room, and that person has to have the proper PPE on as well.
This is heartbreaking. It really is. But that's great that you were able to put the emotions aside for this brief time so you can focus on your patients and the other staff members and just being a support for everyone. And what an amazing thing for you to do. I mean, not many of us can say we can do something like that, but what are some things that maybe we could do to help you guys, to help just anything? Like sometimes it feels like you can be so helpless in this situation. Are there certain things that you would recommend us doing?
Really staying home, even if they open up the economy and open all the stores, don't rush out. Don't, if you are feeling sick, if you are showing symptoms, stay at home. The best place for any of us is at home right now, unless you're an essential worker. Wash your hands, wear a face mask. This is not going away quickly. It is not. Even when they open the economy, it's still around. So we have to continue this.
Yeah, the hardest part, well, one of the hardest things for me to grasp is that, everybody keeps saying, "Well, I can't wait for things to get back to normal." And I don't really think our normal from what we used to know before this is going to come back. I think it's going to be different. Um I don't know what that future looks like, and I know that's stressing out a lot of people, a lot of businesses, but at the end of the day, I do think we need to see the big picture and save more lives. That's really what we're doing by staying home. And I know it doesn't sound heroic. And I know a lot of us have these first world problems where we're not allowed to go do this or get our hair cut. And I mean, we're human. We gripe about these things, but I think just hearing stories like from you kind of reiterates that we are doing the right thing and we're staying home and helping you out in the long term. So I appreciate you sharing your insight. Any other takeaways or anything else you would like us to know about your experience?
No, New York is still a beautiful city, and I hope to come back after this is all over and they recover. But all the commercials that you're seeing on TV that says that stay at home, that's your part. My part as an essential provider is to go and to help people on the front lines and put myself at risk. Your part is to stay at home, because if you get sick, you're going to end up, hopefully you can just stay at home and recover. But if you get sick enough and end up in the hospital, that's just one more person that we're, already at our end that we're taking care of. So if you can stay at home, if you can wash your hands, use your hand sanitizer, help others by doing that. That's the takeaway from this, is just do your part and stay at home. And that's harsh, and so people don't want to hear that, but please, we are begging as nurses and respiratory therapists, CRNAs, doctors, EMTs, police officers, paramedics, all of us are begging you to stay at home. Even when they open up the economy, stay at home unless you have to.
Yeah. And I think it's just that simple realization that that's just what we have to do until we have more information about this virus and more research and cures, vaccines, whatever that is. I'm not a scientific person, but I think you're right. I think we just need to do what we can to help and support you guys. So I appreciate you coming on. I know you're exhausted. I know you're tired, and you have a lot of things going on in New York, but for you to come on and talk to us and share your story is very amazing. I commend you for making a huge decision to just go to New York for a few weeks and fight one of the scariest viruses that we've known in our lifetime anyways. But yeah, I wanted to pick your brain, and I'm so appreciative of you, and I can't wait for you to come back and you can quarantine and rest your brain for a little bit. But that's really it. I thank you so much. And if I guess if anybody wants to know more about you don't really have a social media channel or anything, but you have a personal page, and I have been enjoying all of your updates and posts. But and I share them with everyone. I'm like, oh, look what Mandy's doing. I'm so proud of you. Like Mandy and I go back to, we used to be neighbors together, and we had our babies around the same time. And I remember you were juggling motherhood, nursing school, all sorts of things. And so to see your growth and you make a decision like this is just amazing and honorable. And I appreciate you so much. So thank you so much.
Well, thank you. And Scarlett has already called for us to have a play date soon.
Oh, I know. Once this is all done, I mean, it's just
Yes.
awful. It's an awful time. But like I said, thank you so much. And that's all I got, guys.
All right, thank you. And anyone who wants to follow me, you can. I'm sure my page is not hard to find. It's under Mandy Thomas. I will add you. Send me a message. Do whatever you need.
Yeah, we'll include your link on the website if you guys want to follow her personal journey, or professional journey, rather, both. Because you do have one day off. I'm surprised you got out. I would have been like so tired just staying in bed all day, but you got to go explore New York.
I just needed to see it. And next Monday we're going to be going to Central Park and see some more of the old churches and Empire State Building and stuff like that with our mask on, our hand sanitizer, and most of this is done from the car.
From the car. Okay. I like that. Okay. Well, we'll look forward to that post on next Monday then. Okay. Well, take care of yourself. Okay.
All right. Thank you.
All right. Thank you.
Bye.
Thank you for listening to today's show. Make sure to visit our website, SheLivesPodcast.com, where you can subscribe to never miss a show. Find us on social at She Lives Podcast. While you're at it, if you loved today's episode, please take a moment to share with your friends and family and leave us a 5-star rating on iTunes. Talk soon.